Alright, so the topic I selected for my presentation was the opioid epidemic in the United States. This is also known as the opioid crisis. With an estimate of more than 115 deaths each day in the United States, the opioid crisis continues to be an exceedingly relevant epidemic in our healthcare system. Throughout my presentation, I will be discussing the opioid epidemic and its effect on various areas of the United States healthcare system. As you can see in this overview slide, in my presentation I will be discussing what the opioid epidemic is, who and how it affects individuals in the United States, a quick breakdown of its history, and how it relates to several areas in our healthcare, specifically cost, quality, and access. Furthermore, I will be including what we can see in the near future concerning improvements related to this crisis and additional resources for those interested. I will then conclude with a quick summarization of everything I will share in my presentation. I would like to begin by explaining what the opioid epidemic is and the impact of this subject in our communities and services. As defined by the United States Department of Health and Human Services, the opioid crisis is the widespread abuse of prescription and non-prescription opioids. Also listed below are some common and well-known opioids like pain relievers, codeine, morphine, among many others. To give a better understanding of the impact of this subject in our society, I included some background information on the history of the opioid epidemic. I also wanted to include some quick statistics on the topic as detailed in one of the journal articles I have selected. Reading from the slide, you are able to see that in President Donald Trump's State of the Union address, featured in the journal article, he discusses the fact that 2/3 of drug overdoses in 2016 were opioid-related, and that from the year 1999 to 2016, opioid-related deaths here in the United States have quadrupled in size. It has also been found that between 8 and 12% of those prescribed opioids grow to abuse their medications due to developing addictions. Something I found to be very relevant specifically to us here is that from July of 2016 to September of 2017, the Midwestern region of the United States, an area that we Missourians fall into, saw a 70% increase in opioid overdoses. I will be discussing the history that led this epidemic to where it is today. The opioid crisis began over 20 years ago after pharmaceutical companies made a false claim stating that opioids were not addictive, causing medical providers to prescribe them on a greater basis without actually knowing their true risk. Opioids were and are currently most used in the use of patients' pain management. This epidemic has grown quickly in a shocking number. In 2009, the United States consumed extremely large amounts of these following opioids listed, as you can see from the screen. When looking at who suffers from these addictions to opioids, a study found that Caucasian individuals, typically men, were found to be most likely to have an opioid-related overdose. This is due to the fact that white patients are more likely than other patients to be prescribed opioids by their physicians. Others affected include young adults, older teenagers, and adults the age of 55 or older because they are also more likely to be prescribed opioids on a daily basis. With the growth of this epidemic, new and better approaches are being created in order to improve the quality of healthcare surrounding the issue. A large focus has been put on decreasing the number of opioid pain reliever prescriptions and the use of these opioids overall. This push has also a large focus on the use of primary, secondary, and tertiary opioid addiction prevention strategies. Quality improvements have also been seen in emergency departments to better assist in situations of opioid overdoses. As time has progressed, new methods of pain management are also being explored to further decrease the use of opioids for pain management. To help decrease the number of prescriptions made by physicians, access to healthcare services concerning opioids have been made more difficult. The government has passed new prescription monitoring programs to deter doctor shopping. Now, when a physician is prescribing an opioid to a patient, the patient must go through a series of screenings, which include risk assessments, prescription agreements, treatment plans. Physicians also have to enforce clinical training in their medical settings to further aid in decreasing the number of opioids prescribed. Continuing to discuss the access to healthcare, the FDA has also increased control over manufacturers of opioids and has introduced a proper disposal procedure for leftover medications, specifically for patients. To help those suffering from addiction, new treatment and prevention programs are also being funded by the national government, specifically to target the needs opioids satisfy in the pain management related cases. Now we get into the cost of healthcare in relation to the opioid epidemic. This crisis affects the cost of several aspects of the United States government, such as the healthcare resources, the criminal justice system, and the laws made by pharmaceutical companies. Not to mention that this epidemic causes an emotional and mental toll on individuals suffering from addiction and those surrounding them. A study found that individuals, specifically surgical patients who suffer from adverse drug events due to opioid abuse, have increased length of stay in hospitals. They also are found to have more treatment needs, leading to higher medical costs during their stay. I wanted to include this study to further grasp the monetary costs that come to those who suffer from these addictions instead of just highlighting the overall costs the nation suffers as a whole. Now, when looking at the cost for the nation, one is able to see how much of a monetary impact this issue has. In 2015, the estimated cost of the opioid epidemic was $504 billion. This is largely 2.8% of the nation's national gross domestic product. Getting more in depth in cost, President Donald Trump addressed this issue in his State of the Union address and stated that under the 2008 Consolidated Appropriations Act, nearly $4 billion has been assigned to help better this crisis. In this slide, I have also listed how the $4 billion will be broken down and where it will be going to. In addition, it was also found by the Center for Disease Control and Prevention that an estimated of $78.5 billion is spent a year on the misuse of medications. Nonetheless, the opioid crisis is a progressive issue in our nation and affects many aspects of how our government functions. In my presentation, I was able to explain how it directly affects quality, cost, and access. Through the Consolidated Appropriations Act, recently passed, hopefully in the near future, we will see improvement towards the issue that's causing the death of 115 individuals each day in our nation. Thank you, and here are my references.